Hi, I'm Hannah Zeavin, and I'm a lecturer at UC Berkeley in the departments of history and English. This year, I'm a visiting scholar at Free at UC Davis, and I'm so grateful to be participating in Beyond Health, this year's theme. My research program focuses on the co-constitutive social and political factors in technology used in the name of care and health from the 19th century into our contemporary landscape. I focus on technologies at the interface of people in distance relationships, technologies that are charged with the task of doing exactly what we're doing right now, relating across distance, not even knowing whom the other one is. Technologies that allow us to communicate where would otherwise not be possible, especially in the context of helping and kin relationships. The relationships I'm interested in and focus on are extraordinary or primary sites of connection or disconnection, and each serve as a case study for how to think about negotiating the politics and problems of technologized interaction for health and care. The Beyond Health theme spoke to me in particular, and I was thrilled to find a community of scholars working in this area precisely because the valences surrounding healthcare and especially mental health care, which is what I work on, are quite binarized, good and bad. And so are the valences around technologized care, better or worse, and are just not complicated enough, to my mind, for thinking through the question of how care is operant and operating and what we might even mean by health or care in the first place. My work looks at distance mental health care writ large. In the early days of the COVID-19 pandemic, we saw immediately, and it was written in all of the sort of mainstream news, that there was to be or was already a second wave, a mental health crisis that touched everyone. Trauma, thought of as belated, was now seen to also be preemptive or apprehensive, a suspended state of knowing that ones will die, but not whom, of living in fear that one may die, but just not yet. And that trauma was only in response to the primary losses or so-called primary losses of life, of health caused by COVID-19, but not by, say, systemic inequality and medical redlining or their intersection. What will happen to bodies, let alone the psychological havoc that oppression, massive job loss, medical debt in the US context, and isolation of social distancing bring. Teletherapy has been pointed to as a tool that can intervene perhaps uniquely in ameliorating these sets of traumas and their intersections during necessary social distancing. There was widespread support for the switch to teletherapy at almost every level, from private practices to insurance companies, institutions, and policymakers, even as it made many individuals nervous. And in the United States, suddenly, we had a massive shift in insurance policy, especially by March 19th of last year, 2020, 4 out of the 5 big insurance companies had updated their insurance policies to completely cover teletherapy, including all out of pocket costs. And this was for a provisional period that's been extended subsequently. Suddenly, we had a way to make use of mental health care for 130 million Americans, if only there were practitioners, if only it were truly accessible. Teletherapy is now everywhere, however unevenly it can be made use of. No longer a shadow form of psychological care, it is the dominant mode in much of the world and has been so for nearly a year. But there's a surprisingly long history to the practice, which I take up in my book, The Distance Cure, A History of Teletherapy, which will be out later this year from MIT Press. The book considers one relationship across the late 19th century into our present, that between therapists, broadly defined, and patients. It looks at one modality of care, teletherapy. The distance cure makes a few interventions by examining the therapist and the patient working at distance from one another, dislocated over time and space. Globally, it tells the history of clinical psychology via this shadow form, teletherapy. Instead of this being a recent concern, I argue teletherapy and telemedicine have been about to make their grand debut over and over again for about 100 years. Teletherapy is as old as therapy itself. Then the book first takes the extraordinary and vulnerable and intimate relationship between therapist and patient and recasts that relationship not as a dyad or pair involving two people, but as a triad, always involving mediation and technology. I argue that since Freud stopped laying hands on his patients as part of hypnosis, some intervening distance has always been present between patient and therapist. Then I proceed to look at how patients and therapists have bridged that gap, moved beyond that distance in order for communication to happen, sometimes productively and sometimes not. Mediated, networked, and teletherapeutic relationships physically literalize this separation, even as they work to diminish it. As I conducted my research in order to make a critical history of teletherapy, it turns out that teletherapy almost always attends crisis, whether in World War I, World War II, the war in Algeria, suicide epidemics in San Francisco, and of course, our current pandemic unfolding right now. While these cases are each quite different from one another, I unite them by making the claim that distance isn't the opposite of presence, absence is. So if tele isn't an absence, what is it? The book elaborates various forms of what I call distant intimacy as they're harnessed by disparate groups of users, activists, and clinicians in the service of connecting once again. I go through 5 different chapters as well as a coda on the present. The first chapter takes up the claim that Freud is not just the so-called father of psychoanalysis, but he's both the first telepatient and teleanalyst of that nascent practice. In the second chapter, I move to new disseminative and broadcast forms of mental health care delivery, from the advice column, radio show, and now podcasts, as they attend moments of geographical and political crisis across the 20th century. These cases are wide ranging. They include maternal health broadcasts to radical radio work of psychiatrists like Frantz Fanon and Felix Guattari. In the third chapter, I elaborate a standalone history of the suicide hotline and its remediation into activist forms of telephonic care, from queer priests in San Francisco to the Young Lords in New York City. The fourth chapter looks at what happens when teletherapy drops that third term of the clinician and just it becomes a form of care put on the self. So between the computer or mobile phone, as in many cases, and the patient user. And the last chapter looks at the long history of e-therapy starting in the 1980s through to our present, and looks at relationality, intimacy, and liability in human computer interaction in the service of therapy. And finally, I have a coda that looks at teletherapy in our current pandemic, which brings us back to the present. At Free, I've been seeing the distance cure through production, but I'm primarily working on my second book, which takes up and furthers these concerns on the grounds of a different relationship that we also presume to be dyadic, that between mother or parent and child. Mother's Little Helpers, Technology in the American Family is a feminist technoscience study of how and why technology becomes an indispensable but understudied intermediary in the intimate relationship between parent and child. And I offer there an account of the contradictory drive to preserve quote unquote natural parenting over and against a history of assistive devices, digital redlining, and medical and social service intervention. Mother's Little Helpers contributes a history and a theory of the contradictions of technoparenting by an investigation of the ways in which technologized parenting is interrelated with racialized concepts of maternal fitness, classed medical redlining, and socio-medical surveillance of children and their other caregivers. And again, I couldn't be more grateful to the community I found at Free for facilitating a year-long conversation focused on studies of health and care. Thank you.